Hello, everyone, and welcome to today's webinar, Classification and Routine Environmental Monitoring for GMP Cleanrooms. I am Michelle Ashton of LabRoots, and I'll be your moderator for today's event. Today's educational web seminar is presented by LabRoots and brought to you by Beckman Coulter Life Sciences. To learn more, please visit www.beckman.com. Let's get started. Before we begin, I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want at any time you want during the presentation. To do so, simply type them into the Ask a Question box and click on the Send button. We'll answer as many questions as we have time for at the end of the presentation. If you have trouble seeing or hearing the presentation, click on the Support tab found at the top right of the presentation window, or report your problem by clicking on the Ask Question box located on the far left of your screen. This presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located at the top right of the presentation window and follow the process to obtain your credits. I now present today's speaker, Tony Harrison, Senior Marketing Manager at Beckman Coulter Life Sciences. For a complete biography on our speaker, please visit the Biography tab at the top of your screen. Tony, you may now begin your presentation. Welcome.
Thank you. Thank you very much for that introduction. Hello and welcome everyone to this short webinar today on cleanroom monitoring and classification, specifically for the GMP environment. My name is Tony Harrison, and I'm a Senior Manager for Beckman Coulter. I was also the UK expert to the ISO working group responsible for writing the 2015 edition of the ISO standard for cleanrooms, ISO 14644-1. So I wanted to share this quote with you today because sometimes cleanroom routine environmental monitoring programs can seem very burdensome and very manual, and the sheer volume of manual sampling leading to a high volume of data to be managed. These sheer volumes of data can be confusing and can lead to a lack of clarity, sometimes unfortunately resulting in data integrity errors. So in today's short webinar, I will cover the GMP requirements for cleanroom monitoring and the requirements for classification and explain the difference. I will also outline why routine monitoring presents such a challenge to data integrity. And finally, I'll give you some brief highlights on the new Clarity software for routine monitoring and how it can automate these programs and help reduce data errors. So first, let's take a look at the rule governing GMP cleanroom contamination control. Cleanroom contamination control for sterile GMP manufacturing is defined in the European GMP and the North American cGMP documents. And both these GMP documents reference the ISO standard I mentioned, ISO 14644-1, for the methodology for cleanroom classification. So let's take a look at the GMP regulations controlling the contamination levels in these cleanrooms. This is the current table for air particle contamination levels in the European GMP Annex 1. And it's also used in the Guide for Sterile Manufacturing from the World Health Organization. You can see there are 4 grades of cleanroom defined, from the cleanest, grade A, through to the dirtiest, grade D. And you can also see that the European version of GMP calls for 2 particle sizes to be measured, 0.5 microns and 5 microns. Now this is the same the world over because the World Health Organization uses the same standard as well. The only exception to this is the North American cGMP, which currently only calls for 0.5 micron particles to be measured and reported. Now, all particle counts are reported in particles per cubic meter. And this in itself can present an area of potential error for our users, because in order to reduce the amount of time taken in routine environmental monitoring programs each day, the sample taken at each location is typically reduced to just 1-minute samples. Now, with a particle counter that captures 1 cubic foot of air per minute, it means that the sample volume is just 1 cubic foot because it's 1-minute sampling. Now, there are approximately 35.2 cubic feet in 1 cubic meter of air. So the user must multiply the count results by 35.2 to get the counts per meter. Now, most particle counters can be programmed to automatically make this calculation for the user, but it's another configuration step to remember to make to ensure the results are reported correctly according to GMP. Now, people are the biggest source of contamination in the clean room environment. So workers in clean rooms have to pass through several different clean rooms to enter the production suite where the aseptic fill takes place. Each area is separated by an airlock to minimize the flow of air from the dirty outer rooms into the clean production areas. Particle counters have to be sanitized as they pass from one grade of clean room to another, and this is typically done by spraying them with an industrial alcohol spray called IPA. The dirtiest room is the grade D, and staff are required to change out of their outdoor clothes here and into clean room clothes. They then pass through into the grade C preparation area where equipment used in production is prepared. Finally, they will be required to change their clothes again as they pass into the production area itself. Generally, the grade A production filling area is protected by a barrier system, an isolator or a restrictive access barrier system, a RABS. And this prevents the workers from entering into the aseptic core. And so around this restricted access barrier can be grade C. However, if there is no physical barrier into the filling zone, then the background around the grade A must be grade B. Now, the North American FDA cGMP document differs to the European and the World Health Organization guidance in that it only mentions one particle size, the 0.5 micron particle. Now, if you remember, the European version talks about 0.5 micron and 5 micron particles, so it's quite different. However, anybody based in manufacturing in North America and wanting to export their products and sell them outside of North America will have to count particles of both 0.5 and 5 microns, as they must in fact be in compliance with the standards of the country to which they want to export to. Now, we're all very aware at this time that the industry is in the middle of a search for a cure for COVID-19. And of course, that's the very disease that's keeping us all at home and forcing us to have virtual webinars like this one. Now, vaccine manufacturing plants are a rather unique subset of biopharma production in that the production of a vaccine is usually done by cultivating high concentrations of the disease-causing pathogen in bioreactors that are optimized to support microbial growth. This gives the manufacturer additional challenges over and above the other manufacturers of injectable sterile drugs, small molecule drugs that is, because extra care must be taken to avoid contaminating bacteria from the production staff from getting into the bioreactors. And at the same time, great care must be taken not to allow any of the pathogen itself from cross-contaminating other products manufactured in the same facility. Hence, in vaccine production lines, the staff and the equipment working on them are usually kept separated to prevent cross-contamination. Now, this means that they cannot move particle counters from one clean room to the next because the particle counter could cross-contaminate the second room. So these challenges are so well known that the World Health Organization have a dedicated guidance specifically for environmental monitoring of clean rooms in vaccine manufacturing facilities. Now, as I mentioned earlier, both the European GMP and the North American cGMP documents tell the reader to refer to the classification procedures laid down in ISO 14644 when they are classifying their clean room. Now, the ISO standard is not a GMP document, and it's actually really designed to give guidance rather than mandate, but the fact that it is referenced by the GMPs gives it the same status as the GMP document for those manufacturers regulated by GMP. Now, this standard has a wide range of cleanroom classes, as you can see, from 1 to 9. And it also covers a wide range of particle sizes from 0.1 micron to 5 microns. And you can see in the middle of the chart there the number of particles per cubic meter for each class which is allowed. Now, the idea is from the ISO standard that the user must decide what particle sizes they're interested in and how clean the clean room must be for their process. And then they choose a subset of the clean room class and particle size from the ISO table. Now, GMP has decided that the particle sizes of interest are 0.5 and 5 microns. And you can see that grade B at rest, the number of particles match ISO 5. There's your 0.5 and 5, and there's the number of particles. So you can see GMP has taken a subset of the ISO standard. An important thing to note, and a very contentious issue, is that the 2015 version of the ISO standard 14644-1 does not specify the number of particles at 5 microns for ISO class 5. There's no number given. However, regulated clean rooms need to comply with the GMP rules, not the ISO rules. So if GMP says they are required to measure 0.5 and 5 microns, so they have to do that. So the fact that the ISO standard no longer mentions the 5 microns, it used to, but it doesn't now, it does not mean that the GMP clean room users do not have to measure them. They still do. Okay, so we've taken a look at the rules and regulations for clean rooms. Now let's move to the difference between monitoring and classification and why these two things are very different. Portable air particle counts are used for two separate applications. As I said, the first is clean room classification and the second is routine environmental monitoring. And as I said, they're very different things. The clean room classification process is defined very clearly in ISO standard 14644-1. Whereas it is the responsibility of the customer the user to define the routine environmental monitoring program specific to their own production process, their product, and their clean room. So typically, no two routine environmental monitoring programs are the same between different sites. Now, the challenge here is that the absence of any specific guidance for routine monitoring frequently leads cleanroom users, from what I've seen in my experience, to default to using the same points for monitoring as they used for classification. However, I can categorically say this is wrong. Each cleanroom user has to take ownership of their environmental monitoring program, and they must design the program based on a risk assessment of their specific production process, their specific product, and their clean room. Now, classification focuses on the clean room itself to ensure it is performing to the target cleanliness levels. And the process is very well described in the ISO standard, and typically in the GMP environment, it's carried out every 6 to 12 months, typically from what I've seen. Now, this is just an example of clean room classification. It's not meant to mandate anything specific to you, but in this example here, the ISO standard 14644-1 tells the user how to calculate the number of sample locations required for this clean room, and then tells the user to lay these sampling locations out in an evenly distributed grid pattern across the room. There's no requirements mandated to take a sample where the product is at risk of airborne contamination. So in this example, following the ISO 14644-1 means there are no samples taken in areas where the product may be at risk. For example, the vial descrambler table, the filling zone itself, and the stopping or the capping station. Now we're switching to monitoring. So we've gone from classification to monitoring. Now there's no regulations specifying sample locations here. There's no hard and fast rules. GMP tells us that the user must make a risk assessment specifically of where the product may be exposed to airborne contamination in the manufacturing process. And they must set sampling locations at these points for their routine environmental monitoring programs. So now, if we go back to the example I used a moment ago for classification of a clean room, in this theoretical example, the user has taken a look at their manufacturing process and they decided on those locations where the product may be at risk. And instead of laying out in the grid format like we did for classification, for monitoring, they've laid out their sampling program appropriately. And you'll notice that these sample locations defined by the little yellow dots there, they're laid out very differently, very different locations to those that were used for classification. And that's why classification is not appropriate for routine environmental monitoring, because there's no consideration made as to where the product may be at risk. Okay, so that's the difference between monitoring and classification. So now let's take a look at the root cause as to why routine environmental monitoring can prove challenging regards to maintaining data integrity. This is a typical manual sampling and counter configuration process that I've witnessed in clean rooms. It's a very manual process involving the collection of thousands of samples each month at each site using portable air particle counters. Typically, there are many manual SOP steps to be followed in the routine environmental monitoring program. And the first of these is the technician firstly has to make sure they're using the correct version of their environmental monitoring SOP. Sometimes they change and you need to make sure you've got the right one. And of course, they're paper-based, so you need to make sure you're using the correct SOP. And then they have to follow the sampling map defined in the SOP and go to each sample location marked on the sampling map. And then they have to manually type the location name for the sample into the counter via the on-screen keyboard. And next, they have to configure the counter to sample for the correct amount of time and for the correct number of samples according to the SOP, and this may vary for different locations. Having taken the sample, the next thing they do is print the sample results out from the counter and handwrite comments onto the printout and sign it. Oh, with their name. And by signing it, they're making it attributable to themselves. And at the end of each day, they photocopy all the printouts and then they manually transcribe the results from each and every piece of paper into an electronic record. And remember, there's typically hundreds of these per day and thousands per month. And finally, the electronic record is reviewed by the supervisor to ensure that all the samples have been taken and that the data in the electronic records match the paper printouts. So they have to manually check that the electronic record matches the paper printouts. Now you can see this is a very manual process, and with thousands of sample pieces of paper and manual data transcriptions every month, sadly, the opportunity for human error to creep in and impact the integrity of the data is extremely high. Now, in their 2018 Frequently Asked Questions paper, the FDA highlighted that they were observing increasing levels of data integrity issues, and they encouraged the industry to put in place strategies to better manage their data integrity risks. In their 2018 guidance on interpreting their 21 CFR Part 11 data integrity rules, the FDA introduced the acronym ALCOA. And they were saying that a good electronic record should be attributable, which is the first A in ALCOA, and it should be attributable to the person taking the sample and the sample location. It should not be handwritten because sometimes handwritten can be misinterpreted or illegible. And it should be made contemporaneously, in other words, at the time that the sample is made, rather than created at a later time from paper printouts. And finally, it should be the original electronic record, and this is probably the key thing, the data that it contains should be accurate. So you can see we've got an incredibly manual process here with opportunity for human error. And at the same time, the FDA are encouraging us to be more rigorous about these programs, make them more robust. So let's take a look at how routine environmental monitoring can be automated to help improve data integrity using the new Clarity software. Clarity software runs inside the air particle counter itself, so it's not a separate software piece. And it allows the user to improve accuracy because you program the Clarity software with your SOP and the sampling map. So the sampling map appears on the screen of the counter, so no more pieces of paper. And this map creates an interactive version on screen, and all the technician does is go to each location and tap on the location on the screen of the counter, and the counter automatically configures itself according to the pre-programmed SOP in the Clarity software. So the accuracy is improved because all the technician has to do now is tap Run Sample. There's no configuration or manual data entry required. And finally, accuracy is improved as the SOP version control is now done inside the counter itself. So administrators log on remotely via web browser, there's no software required, and they configure the SOP and they release it using their electronic signatures for use by the technicians. Clarity software creates the final electronic record inside the counter contemporaneously. There's no more need for paper printouts or manual data transcription, because the record it creates contains the SOP name and the version number that was used when the technician did the test. It contains the user electronic signature, which is controlled by Microsoft Active Directory. It contains the production batch ID, the location name, date and time, configuration of the counter, sampling results, including the volume of sample taken, and of course any alert and action alarms. And the user can manually enter through the counter screen using a QWERTY keyboard any comments which are saved with the electronic record. There is also review and approve workflow built into Clarity, which sits inside the air particle counter. So the Clarity software allows the administrator or the supervisor to log in remotely over their corporate network using a web browser. There's no specialist software required. The Clarity workflow inside the counter allows the day's sampling to be reviewed and approved for accuracy remotely just using this web browser interface. And then it creates an electronic record with the electronic signature attached of the supervisor or the administrator, ready to export straight from the counter via USB or wired Ethernet or Wi-Fi. The counter also contains an integrated audit trail, which again helps with accuracy. Any changes to the user ID or anything like that is recorded in there. User logons, success and failures, logout, sample start, sample completion, new users added, changes to an SOP. All of this is recorded inside the audit trail in the particle counter itself. And that forms an electronic record, which again can be exported. So that was a quick overview of the Clarity software that's inside the new MET1 3400 Plus. And I hope you can see how it should help with improve the data integrity for these very manual processes. So thank you for listening today. I hope you found it informative. And now perhaps, Michelle, if we can go to any questions that you may have in the chat, please.
Absolutely. Thank you, Tony, for your presentation. We'll now start the Q&A portion of the webinar. If you have a question you'd like to ask, please do so now. Just click on the Ask a Question box located on the far left of your screen. We'll answer as many questions as we have time for. All right, let's go ahead and get started. Okay, first question, Tony. Thank you for your presentation. Please, can you tell me how you can use a web browser to remotely review and approve daily environmental monitoring data? Is the counter connected to the internet?
Well, Thank you very much for your question. It's a good question. So no, the counter is not connected to the internet. What's actually happens is the counter has its own web server inside the Clarity software. So what you do is you use your web browser to connect across your company internal network to the counter. You simply enter the IP address of your network assigns to the counter when it connects to your network into your own web browser navigation bar. And the IP address can be found on the front screen of the counter itself.
Great, thank you so much. Okay, let's see, next question. How does the counter assign electronic signatures to the records?
That's a good question, thank you. And as I mentioned, I think a couple of times in the presentation, the counter actually uses Microsoft Active Directory to control username and password credentials. So when somebody logs on to the counter using their Active Directory credentials, the counter goes across their corporate network and verifies that the credentials they've used match the Active Directory on the network, and then assigns the username to the electronic record. So effectively, your Microsoft Active Directory credentials become the electronic signature. And it's the same verification process that happens when you log on to your own computer. When you log on for the day, you go to work, you log on using the Microsoft Active Directory username and password.
Thanks, Tony. And let's go ahead and wrap up with this last question. How do I know if the technician used the correct SOP version when they did their daily sampling?
Yeah, again, that's a typical challenge that people face because these are typically paper-based. But now all of the SOP version control is done inside the counter using the Clarity software. The technicians only have access to the latest version of the SOP on the counter, and this is controlled by the manager or the administrator who program the current SOP version into the counter, and they release it for use using their electronic signature, again using Microsoft Active Directory. And so you can verify, which I think was the question, which SOP version which was used, because the SOP name and version number used is recorded in every electronic record that the Clarity software creates.
Thank you again, Tony, for your time today and your research. We would also like to thank LabRoots and our sponsor, Beckman Coulter Life Sciences, for underwriting today's educational webcast. Before we go, I'd like to thank the audience for joining us today and for their questions. Any questions we did not have time for today and those submitted during the on-demand period will be addressed by Tony via the contact information you provided at the time of registration. This webcast can be viewed on demand. LabRoots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's event. Until next time, goodbye.